Okay. All right, should be good on LinkedIn. We're good on Facebook. This one's always playing up. Okay, Twitch is good. Twitter's good. Sorry, guys, just bear with me. I'm just making sure we've got the Instagram going. Just bear with me there, guys. Okay. Sorry, guys, just bear with me whilst I get this Instagram login going. Got a couple of viewers as well now. Okay. All right. Okay. Technology, one of those things. Okay, we should be good. All right, we're good. All right, thanks for bearing with me, everyone. So, hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with the dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Lawrence Doan, and tonight we are joined by Dr. Grace Cooper. She's a general dentist in Perth, WA. She obtained her DMD from UWA in 2018 after obtaining her Bachelor of Science from also UWA in 2014. Grace is the fourth generation dentist in her family. Her great-grandfather graduated from Royal College of Surgeons of England in 1920, followed by her grandfather, her father, and today she carries on this legacy. Grace is fortunate to see many of her father's previous patients and also quite a lot of her grandfather's patients. Grace loves being a general dentist due to the great variety of work with the profession. Although she has a particular interest in aesthetic dentistry and conservative restorative dentistry, she loves how dentistry requires a mixed bag of skills, and no two work days are the same. Dr. Grace Cooper, welcome to the show.
Thank you so much for having me.
So you have a particular interest in aesthetic dentistry, conservative and restorative dentistry. Tell us about your CPD journey so far.
Yeah, so as you mentioned, I have a really big interest in sort of a bit of everything. I do love the variety that general dentistry entails. But in terms of, the aesthetic and minimally invasive restorative dentistry, so far, I guess my biggest CPD avenues that I've taken are Invisalign. That's a huge one for me. And I've also done some courses on anterior composites. And they're probably the main ones that I've done that I really enjoy in those kind of realms. I've also done CPD on like crown preps and like restoring implants and like the theory of implantology, that kind of stuff. So like I say, nice variety. But yeah, those are the kind of the CPD courses I've done that have really helped my journey and my interests.
Yeah, was it the anterior one? That was in Melbourne, wasn't it?
Yeah, with Dr. Anthony Mack. I did that in 2019, back when, traveling for CPD was a bit more possible.
Yes.
Yeah.
And how did you find it? Well, I mean, was there a particular reason why you were taking Invisalign? You were taking these anterior composite ones?
Yeah, so the interior composite one, it was really, really interesting. I did it in my first year out from dental school. So it was really interesting to learn like different materials and different ways to do that kind of dentistry that you don't really get in dental school. Again, it's more about the materials that you use. And then Invisalign, I actually had Invisalign treatment during dental school. So even though the ortho side of, ortho lectures at uni were not my favorite, actually having Invisalign and changing my smile while most people were none the wiser was like, oh, I really, really enjoy this. I like this. I want to be able to give this to my patients as well.
So you've consumed some, education, direct from on hands-on courses. Have there been other places that you've kind of consumed education-wise?
I do like the ADA online lectures. They're really good when you've got a day off and you've got some downtime, just to keep up with, again, bits and bobs in different areas. Also, in particular with Invisalign, they also do webinars specific to Invisalign. So I watched an Invisalign webinar a few weeks ago, specifically about using their ClinCheck treatment planning software and how to, utilize that and maximize it. So there's still continued online education in that realm as well. So I do like the online ones, but I think I am partial to hands-on courses. I learn by doing.
And I guess we all, learn by doing as well. But you work on extracted teeth as well sometimes.
Oh yeah. So a big thing at the clinic that I work at is my principal dentist wants me to learn as much as I can, but without how you learn sometimes by making mistakes and failing, which is part of dentistry. But as a young grad, he's like, I don't want you to have to like learn the hard way. So they've gotten me to get extracted teeth and to like look at the root canal systems, more so when I just graduated, to do like suturing at home. Like they're giving me like artery forceps and expired sutures to like, practice that kind of handiwork. They're really big on, me learning, but not having to learn the hard way and have that kind of stress.
Yeah, I guess it's good to have that kind of mentor, I guess, to have that. So you're not stressing out on, in chair per se, when it's all happening and things are all kind of messy. It's kind of, you've got that muscle memory kind of going on. But prior to doing dentistry, you were also a dental assistant.
Yeah, back in dental school, I was a dental assistant on the weekends. That was huge for me in learning like real life dentistry, because you learn the theory at uni, you learn the public system at uni, but being a dental assistant and actually working in a private practice, I think it really helped me like observe real dentistry, and you learn lots of little tips and tricks that you just don't learn in dental school.
And so were you picking these courses because of what your boss / mentor was trying to encourage you to do, or was that because that was the type of work that was kind of happening at your clinic?
That's a really good question. What actually pops to mind is a course that I was thinking about doing and actually ultimately chose not to do because of my boss's advice. So usually the courses I do are out of an interest, and I think, oh, this looks pretty cool. Oh, this day I'm not working. This looks interesting. I'll try this. But actually I think it was 2019, I was interested in doing a Botox and dermal fillers course. And I was working at 2 different clinics, and I spoke to both of my principal dentists just for their advice, because the course was very expensive. And I said, look, this kind of interests me. What do you think? And both clinicians said, do what you like, but you might not be utilizing that so much at the moment, and you might not get, your money's worth, because at both clinics, Botox and fillers, it's not really what patients are looking for. I'm now just at one clinic. But yeah, it would have been a lot of money for me to maybe see like one patient every maybe 4 to 6 months. So getting their input is has been quite helpful for me. I do like to get their recommendations.
And so what were some of those takeaways so you were saying that because the patients weren't going to be doing a lot of it, that's why you opted to not do it. But you're not against Botox though.
No, not at all. I think it's super interesting. And I've actually had Botox on myself. My colleague and friend, Dr. Pani Ansari, I was actually her patient that she trained on. So she did it all for me. And I have a very gummy smile, and I see her to put Botox here to prevent my very gummy smile. I think it's a great system. And I think it's, especially, for these dental kind of things, it's a great material that we have. It's just, it's not something that I would be personally doing a lot myself, because it's just not the treatment that our patients are seeking. So not as useful for me.
So what would you say is of those few CPDs, what's been the biggest clinical impact on your dentistry today?
I think the biggest impact would definitely be the Invisalign training. I absolutely love doing Invisalign. I only do like very simple cases. I try to keep it within my scope and my skills. But like I say, having had it done myself and getting to transform patients' smiles, and it's very conservative, like very minimally invasive, rather than the old techniques of having to do lots of crowns and more aggressive treatment. I have a patient who's 61 and we're doing Invisalign. She was told by a dentist 10, 15 years ago to have crowns on all her front teeth. But by doing Invisalign, we've been able to achieve her nice smile without having to do much removal of enamel at all.
Right. And so with ortho, I guess what I'm trying to get at is a lot of new grads come out and they feel obliged to either do ortho through either Invisalign or through a structured. Or is there a particular reason why you picked Invisalign and not maybe a structured program?
At the time when I was deciding and discussing with my boss at the time, she recommended that I do Invisalign because they were going to be changing the way that they structured their courses. So she actually said, you should do this before they change it. You should get in while they still have the old system. You get a more well-rounded education. So I was able to do their full fundamental course before they changed it. So that was a big reason why I did Invisalign. But also, I know that there are other orthodontic, like you can go all the way up to diplomas and even a postgraduate degree, and then other structured courses. But I wasn't super interested in that. Specifically, the Invisalign system that I've had myself was what really interested me.
Sure. So like you mentioned in our bio as well, you've got a family of dentists. If they started at 1920, that's like over 100 years. Yeah. So that's almost like an encyclopedia of dentistry you've got access to. So how has your father, Dr. Richard Cooper, been an influence on you?
Oh, been a huge influence. So, well, I mean, to start, he gave me the idea. There was never any sort of pressure to be a dentist. I just saw that he would come home from work every day and he was always like very busy, but really enjoyed his job, lots of variety, helping people. I thought that looks like a good job. I'll do that. And my dad said, yeah, I think you'd be good at that. That was, all the influence in terms of choosing it. And then when I was actually studying dentistry, such an amazing resource. I was like, I had my own private tutor, like to answer all my questions during dental school, which was amazing. And then on top of that, my dad was actually very, very passionate about CPD. So he's now retired. He retired about 7 years ago now. But before that, I'm talking, 15, 20 years ago, before CPD was actually a requirement, he was doing lots and lots of CPD. He loved to learn about all the new things, like the new technologies, new systems, new materials. He had a CEREC machine 15 plus years ago. He was always going to conferences and courses. And yeah, so just seeing his passion for staying up to date was helpful for me, because then all his knowledge was very current when I was going through dental school.
I see. And that's, I guess that's rubbed off on you to an extent. How about when it comes to like tough cases? Do you just be like, hey, dad, I've got a tough case. You know, I've got this mouth that's ridden with caries. How do I sort this out?
Yeah. So that definitely was me a lot during dental school. And then also first year out, when you're a new grad, kind of like, you've got your P plates and you're on your own, but you're street legal. I was calling him all the time, talking to him. Oh, what do I do about this? What do I do about that? Less so these days because the learning curve has decreased for me. But yeah, definitely. Oh, actually, as a fun fact, when I go to my parents' house now, my mum has actually banned dental talk from the dinner table because we'll just go on and on and on, and it kind of alienates the rest of the family. But yeah, it's such a good resource and thing for us to talk about.
Yeah. So has there been any other big influence in your career path, and why?
Oh, I think well, yeah, other than my dad, I've been so blessed and so lucky with the mentorship that I've had at the two clinics that I've worked at. So they always tell you, when you're a new grad, make sure you work somewhere with mentorship. And I had friends who would work at a clinic and they didn't have the best mentorship. And I felt so lucky because I worked at two clinics with amazing mentorship. So at my first job at Spearwood Dental Centre, Dr. Laura White, she nurtured me and carried me as a new grad, teaching me so many different things about dentistry. And she was such an amazing boss. I was very, very sad when I ended up leaving that job. And now at Harmony Dental, which was my dad's clinic before he retired, the principal dentist, Dr. Jim Hugh, he's always mentoring me with cases, talking to me about difficult situations and scenarios. And my colleague, Dr. Dev Demel, always happy to lend a hand and talk through cases, talk about materials and crown preps and design and all these different things. Everyone has just been so supportive my whole dental journey. I can't believe how lucky I am.
Yeah. Well, on this podcast, sometimes we've had discussions with previous senior dentists, and when it comes to mentorship, it's quite difficult to kind of gauge where it's at. So, was there a discussion when you had with them beforehand, or was it kind of implied? And how did that kind of structure kind of come about? Was it like you had to approach them, or they kind of was open to presenting you with cases?
Yeah. So with my current clinic that I work at, which used to be my dad's, I guess it was a bit more informal, like when I graduated or when I was about to graduate and we were talking about the plan for me to start working. I believe it was Jim who told me that he was going to come in on his days off and mentor me, which, was amazing. And it was just more that informal chatting about, what we're going to do. With my first job at Spearwood Dental, it was during the interview. That's when I sort of asked, what kind of mentorship, and Laura was great in, fully laying out, we'll talk through cases whenever you need help with X, Y, Z. And she explained in the interview how the mentorship would be, which was really good, really good to know right at the beginning.
Okay. So you're a fourth generation dentist, but you and your dad were never pushed into dentistry. Is that right?
Yeah, correct. I asked my dad about that a little while ago. It was never an expectation. It was just, that looks like a good job. I want to do that.
No, that's fair enough. So has there been any particular struggles in your CPD journey so far, or dental journey so far, that some of our viewers might not know about?
Yeah, I guess being a young dentist, there are a lot of challenges that come with that. Like I mentioned before, you have to do a lot of learning on the job. You're going to make mistakes. There are going to be cases that go pear-shaped and go wrong. And having a good support system is a huge game changer for that kind of element. But it is tough. You sometimes go home and you think, like that couldn't have gone worse, or I wish I'd done something differently. But I guess what I've always tried to tell myself since starting working is, well, what I think is, if you want to be a dentist who's been a 20-year experienced dentist, you have to work every day for those 20 years to get that experience. And you've got to just try to roll with the punches and not let it you try not to take work home with you. I think that's probably one of my biggest advice to young grads.
Yeah, as in like try to separate it so that there's a bit of space, even though you when you go home and talk to your dad, it's about dentistry.
Exactly.
I'm only pulling your leg there. So tell us, what does your current clinical day look like? Type of procedures you might be getting up to?
Yeah, well, like I said before, currently lots of variety. That's what I'm really, really big on. So I don't like when if I see my day sheet and I see it's all fillings, I think, oh no. Or if I see like 3 crowns or 3 root canals, I think, oh God, I like to have nice variety. So a crown prep, maybe a root canal, an extraction, maybe an Invisalign appointment, fillings. If it's nice and varied, that's when I'm happiest.
So what do you hope your ideal clinical or non-clinical day might look like in 5 years' time? And what kind of courses do you want to do to kind of get you to that point?
So ideally, in 5 years' time, I think in general being faster. So at the moment, I book really long appointments, really take my time, really big on not being rushed because I don't like a time pressure of running late or people waiting in the waiting room. So over time, getting my clinical skills to being just quicker and more proficient, I think ideally, again, nice varied day, but yeah, being able to go a little bit faster because at the moment I definitely take my time. In terms of CPD, I guess courses that teach, which I have taken courses on how to do hands-on clinical skills. Like I've done crown prep courses and I've done the composite veneer courses. So those kinds of hands-on courses, I think will help utilize that.
So are you looking to do more of those going into the future?
Yeah, I actually have another anterior composite course coming up in October, that one being held by ADAWA. So even though I did do this course already a couple of years ago, I would like to have a refresher because now that, I've been working for longer, clinical skills, I think it'll, set in my mind a bit better doing it hands-on again, like another course.
And is that, so are you feeling like at that time, you probably wouldn't absorbing as much as you could have, and so that's why you've opted to come back again and do it again? Because I think it's an interesting point because a lot of graduates also go through that. They spend a lot of money doing a lot of courses, and that particular point there, and you can only take so much from it. But it's not common that most people talk about, hey, I feel like I want to go back and learn that, particularly with anterior composites. Again, they might be like, I've already learned it, I already know it. What was your thought behind it?
Yeah, because I think that when I did it, again, it was my first year out and it was such a helpful course, but I think it was just too much for me to fully digest and remember every single little step and every material they use and every little instrument. So now that I've got more experience, I think doing, again, it's not the same course, it's the same area but by a different presenter, but I think it'll like I say, I'll be able to take it on a lot better now that I've got those more practice under my belt.
And you mentioned, the porcelain and the crowns, and that, is that because you're feeling like those are kind of the areas you want to improve in, and like you said before, you want to get more proficient at, or is that because that's the type of work you kind of want to kind of get into more? Yeah,
so I think it all falls under my interest in conservative dentistry. So I have a course coming up. It's just a theory, like a dinner kind of course, about crown preps, conventional and bonded, the new way that we're doing crown preps to be more conservative and do direct bonding rather than the conventional aggressive techniques. So I'm really interested in that because, by conserving the enamel in those preps, then it's conservative dentistry. And same with porcelain veneers. I actually want to learn more about porcelain veneers I'm learning more about, like the minimally invasive, minimal preps, the very, very thin porcelains that, are becoming more, apparent. I want to learn about that because I want to be able to do beautiful smiles and beautiful dental work. But if we can conserve, the natural anatomy and the natural tooth structure, then that's perfect for me.
Well, I mean, it makes sense because obviously you're learning about orthodontics and, you're straightening teeth. The last thing you want to do is straighten them all up, only to cut back a sizable amount.
Chop them away, yeah.
Yeah.
That's exactly right.
So how about your non-clinical side of things? Because some of us probably know, but you're pretty big on social media to a degree. Hey, let's start with the fact that you started in 2019 of August, and it took you 7 months to get to 1K followers, and then it took you another 6 months to gain another 1,000 followers. For many new graduates, they feel like it's about the likes, it's about the followers. In fact, people would look at you and want to emulate that same thing. So what are your thoughts on that?
Oh, you flatter me, Lawrence. You're too kind. So I started the social media side of my dental, hobby in 2019, as you say. And I really did it because at the time I was thinking, I didn't think that dentistry was going to be this big thing online, but if it is one day, because the whole world is becoming more online, if dentistry is going to be online one day, I want to be a part of that. I want to be, on top of, the current ways of doing things. So that's why I started it originally. And you say, some people really care about like the likes and the follows and the numbers and all that kind of stuff. If anyone is thinking about that, I would say if you're going to make a dental social media page just for the followers or just for the fame or the clout, I'd say it's not a strong enough motivation, at least not long term. So I do my social media because I really do enjoy it, especially recently, like the videos that I make. I just have so much fun with it. I know that there are dentists who post their clinical work, and I feel like my page is a bit silly in comparison because I'm just making videos and making jokes. But I really enjoy it, and that's what really motivates me to keep posting on the page. If you're only in it for the numbers, you're going to burn out very quickly. It's gonna be very boring for you.
And as we discussed before, for some of our viewers, you've actually dabbled in a bit of drama before. Hey.
Yeah, so in high school and in my undergrad, I was really, really into drama and theatre. That was really one of the best things about doing an undergraduate degree before my postgraduate dental degree. I got to be in the drama club, where I've met so many people who are still my very close friends to today. And I guess the biggest one would have been in the drama club. I met my now husband. So love the drama club, love that whole realm. I wish I had time to do drama these days, but I guess the social media videos will have to do for now.
Fair enough. Well, Dr. Grace Cooper, thank you for coming on the show today. If you could let the people know how they can find you or what's kind of going on in your life at the moment.
Yeah, so if you want to find me on Instagram at Dr. Grace Cooper, just making lots of dental videos. That's my main content right now. And otherwise, I'm just working and just working and hanging out with friends. That's what's keeping me busy these days.
Awesome. So for all of our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe. For our listeners, if you like this episode, leave a review as well, and don't forget to share it with your friends, and we'll see you in the next episode of CPD Junkie Podcast. Dr. Grace Cooper, thank you.
Thank you so much.